sometimes it's hard to talk about, but women are not always in the mood for love, and chronically low libido is the most common thing that people really don't talk about. But today we're going to talk about it. Today we have Dr. Jenny here to help us spice up our love lives. Wow, talk about spice. I saw you at the circus on you and Joey, our producer. You were the guest MCs at the circus Friday night.
So much fun. We had it.
Saturday night.
I went all out. They weren't expecting me to wear the little. I had to look up the costume. I'm like, what does a ring mistress wear? And I'm like, oh, okay.
I got it. But back to a serious topic. So a lot of women need to spice up their love lives?
Oh, it is terrifying. And so many doctors, OBGYNs, we laugh about it all the time, really. We're like 80% of females never experience an orgasm. And that's
horrible.
Terrible, because then it's like you're missing out. It's like, why are you going to let the guys have all the fun?
Oh,
you know?
my goodness.
You need to be able to, I mean, it's what makes the world go round, right? You want to swing off the chandeliers, and it's enjoy, you know, the guys enjoy it when the women are really, you don't want to Harry Met Sally it at all, you know? That's fake it till you make it. But I'm here, I have really good news, positivity, right, on how women can go ahead and increase their libido.
What are the tips to do that?
I always start with, of course, you know, a lot of women don't have foreplay, just simple things, you know. Foreplay, learn to play with yourself, number one. It's your body. If you do not know what gets you going, how do you expect the man to know what's going to get you going? So it's okay to experiment with your own body. Number two, is, you know, make a list of different things that you're taking, like drugs or lifestyle, if you're drinking too much. Birth control will inhibit testosterone in the body, because testosterone is a big hormone with libido, and birth control eats up testosterone like crazy, so then that just kills your libido. Adderall, so you're taking these medications, you know, to increase energy during the day, but then that kills libido in both men and women. And then you're taking things like Xanax and Valium. Yeah, so you got to assess like your lifestyle and different things that you're taking, because it's really become quite a chronic thing.
Okay, so you just mentioned low testosterone. So how is that related to it?
Yep, that's the number one thing. Low testosterone, women will experience symptoms like loss of confidence.
Have a graphic and everything.
Yeah, poor muscle response, so they're not building muscle the way they should when they're going to the gym. Irregular menstrual cycles, you know, women are like every 18 days, every 40 days, or they don't have one at all. And then they can experience acne or greasy hair, like little rogue hairs on the chin or on the face somewhere where they don't like it, anxiety, depression, fatigue, and then skin tags, believe it or not, is a sign of low testosterone.
Yeah. And does that occur when you have too much or
not enough?
So
when you don't have enough testosterone, you're going to have symptoms of those different things.
So it's okay to get or add testosterone?
Yeah, but how do we do that?
Simple blood spot test or blood serum. You can also test through saliva, and you go to your doctor. Any doctor can test. It's a $45 test. It's like, why wouldn't you test it? But once those levels come back, then you're like, oh my gosh, every single woman, it ranges between 0 and 10 when your level should be like 48, 50 up there.
Wow.
Then the moment I give a female a shot of testosterone, 2 weeks, 3 weeks of that, she comes in and she's just like, make it stop! Make it stop! How do I turn it off? I feel like a guy. And I'm like, that's a good thing. Then they're dragging their men into the pharmacy saying, fix him, he can't keep up with me anymore, you know? And it's such a beautiful thing when the woman's like, let's get it on, baby, let's go.
Well, we're feeling this is going to be a Valentine gift for somebody.
Some guy is going to go get their wife a testosterone shot.
Every single, right?
We've had this conversation in my house.
If this is a shot.
Postpartum women, you know, you're thinking your testosterone level's really low. That's great. Our pharmacies, OBGYN's offices, you know, are loaded with women after having babies just to increase their libido again, because nothing's working. But that's just one of the hormones. That's the big one that I think is the most prominent. But you have other hormones like the nurturing love hormone, oxytocin, which is actually a pheromone, but it's that nurturing pheromone that makes you like, oh, you just want to rub up against somebody, you know? And then I have that in a nasal spray or a troche.
Oh, a nasal spray.
Yeah, so it's just like right before, squirt, squirt, you know, you feel like you had 3 glasses of wine, but without the alcoholic effects. And then you're just like, ooh, you're so nice and soft, you know?
I do that and start rubbing up a random people will be a problem.
You can hug me during the show.
It's like, I love you, you know, and that's a great hormone.
Anything else in your bag?
Oh, absolutely. The most popular, the sex creams, all my passion women, the passion parties love my triple orgasmic cream, my scream cream. And so those are topical foreplay creams with small amount of testosterone, vasodilator, so it helps swelling in area. So it's literally, it's a foreplay cream.
So there's legit hormone in these creams.
Yep.
Like it's not just,
And you
ooh,
apply
I'm
it to
rubbing
the
this
area.
on because
Yeah,
I feel sexy.
exactly.
There's something is physically happening.
Exactly. It's not just KY. It's like, that's not going to do anything. You know, you want something that's actually going to stimulate all the nerve endings in that certain, you know, lady bits, right?
Is this safe? I mean, not just the swinging from the chandelier, but are these things safe?
Absolutely, 100% safe, because you're taking what the body actually needs as opposed to playing with creams that, you know, your body doesn't need,
Right.
and carcinogens. It's like, okay, apply what your body needs, you know, reactivate that battery and get it going. Those
I like
toys
the
won't do
idea
you
now.
any good. Those toys don't work.
Reactivation.
Yeah.
We're
Age
interested.
Vital Pharmacy on Main Street, or you can go to agevital.com, and Dr. Jenny will tell you all the secrets. And coming up, we're going to tell you about a dessert everybody is talking about. You've got to have this.